is the story with cholesterol?
Sure. So cholesterol is very important in the body. I mean, cholesterol gets a very bad reputation as being, when elevated, corresponding with cardiovascular disease.
Correct.
Right.
Cholesterol is made by the liver. There's external sources through the diet, and certainly internal metabolic sources that can also be factors in its production and subsequent elevation, if that's the case. Cholesterol is important as being like the chassis or foundation upon which many hormones in the body are created. So the sex hormones, your testosterone, your estrogen, cortisol. Cortisol is the hormone that wakes people up in the morning. So its production starts like 4.
I think my cortisol is
so,
not
so
working
there's
very well.
positive. So there's positive cholesterol. It has a very positive effect on the body as well.
Absolutely. It's even a constituent of vitamin D. Vitamin D, the sunshine vitamin. Cholesterol is the basis from which many hormones are created. But when its levels are in excess, it's been very clearly shown to be a risk factor for cardiovascular disease.
So the rule, too much of a good thing, is going to put you in a compromised position.
Sure.
Okay.
And is that uniform for everyone? Like they say that there's certain numbers that if your cholesterol is above whatever number it is, but are there some people that just their cholesterol just naturally runs higher than other people?
That is one of the factors from an internal metabolic standpoint.
Right.
So external sources, we mentioned diet, and we can talk a little more about that later.
Right.
Internal sources, there could be a genetic predisposition for manufacturing elevated levels or not synthesizing them properly so that they stay within the body at higher levels. But also factors like if there's other metabolic imbalances in the endocrine system, so like a low-functioning thyroid, that can cause elevated cholesterol.
Right.
Increases with age, being sedentary and inactive, that's also been shown to increase cholesterol levels. So there's several endogenous or internal factors that can be.
So
Right.
we really need to get off this couch and get on a bike. Start exercising.
Well, that's probably one of the
That's a
best
good idea.
ways to lower your cholesterol, right? Is that?
Oh, it's an important part
Exercise?
of the exercise is an important part of that program. So
One thing we noticed in the American Heart Association, being instructors and trainers and studying some of the that during the holiday season, people are indulging in more fatty foods because
Right.
they're being sent these foods to them, even though they might not want them. They feel obligated to eat them. They're also stressed a little bit more, right? What's more stressful than buying a gift for a loved one, right?
And being with your
Right?
family.
Exactly, right? You buy a gift and then you have to return it, or you give them a gift card and then they're like, you didn't think enough about me. So we get those problems, as well as we know that the cold restricts the blood vessels, and if you have a high cholesterol level with the blood vessels being constricted, you're more likely to have a cardiac episode. And that's where we come in.
Yes.
and just stress itself
Oh.
changes the internal metabolic terrain.
Right. So what about triglycerides?
Right. So cholesterol and triglycerides are both different kinds of fats or lipids in the body. They get measured on blood work as part of an assessment for overall cardiovascular health, and there's numeric ranges for safe and elevated or unsafe levels. The triglycerides are it's a glycerol base with 3 fatty acids attached.
Okay.
Unfortunately, biochemistry and three-dimensional thinking is a very important part of physiology and understanding how things work in the body. So I had to suffer through a year of it, but when I give free public lectures, people just have to suffer for about 5 minutes.
Okay.
It's lower suffering.
Right,
Good.
right.
Glad
Well,
to hear that.
This is great information. I mean, this is stuff that people don't normally think about, and I think that's important, that they need to think outside the box and they need to look at other angles of it, not just basically what they're shown or heard about from friends. I think that they need to seek out a professional like yourself as an alternative.
And think about it before it's a problem.
Right.
I think that's
and
the
I
issue.
bet you, I'm sure I'm correct, statistically, that you probably have a better rapport with your patients because you probably spend more time with them than if you go to a conventional doctor who spends maybe less than 5 or 10 minutes and you're out the door with a prescription run into the pharmacy to get a prescription. Not to say that that's all bad, but I really think that it's important to develop a rapport with your doctor. To me, that's important. I don't know about other people, but I want to know who my doctor is and that he cares about me.
Yeah, well, as part of the detective work that I end up doing with patients and trying to understand the underlying basis for what their concerns are and getting to the root of the cause, not just treating the symptoms and managing symptoms at a kind of exterior or superficial level. It does require time. So a new patient visit is typically 1 hour.
Is that right? 1
Wow.
hour. So you're gathering a lot of intelligence and information from that patient so that this way you can really put out a report and then evaluate there might be some small minor thing, kind of like you said, you're being a detective. This is a crime scene, kind of like, and now you're looking for, right? Well, it's
Your
true.
body may be a crime scene. Speak for yourself.
It's dressed like a crime scene.
Good point.
Okay, so, and you're looking for that small, tiny thing that could change the whole concept of that person feeling better.
Sure, and I think a good example for this is actually with the statin medications.
Okay.
So statins is a first-line approach that is often taken with patients and through the conventional medical system.
Okay, so
If they have high cholesterol, is that what you're saying?
If they have elevated
Somebody comes
cholesterol.
into a regular doctor with elevated cholesterol, then they would generally be prescribed one of these statin medications.
Right.
Right,
Right.
okay.
Exactly. Statins have been shown to be correlated with certain side effects, like myopathies, myalgias. So that's myalgia is like a muscle pain, and part of the reason for that is because the statins work by lowering cholesterol. This gets back to the biochemistry.
Right,
The level that they come in
I'm
at and
kidding.
affect the body is called HMG-CoA. So they're HMG-CoA reductase inhibitors.
Right.
Further downstream from that is cholesterol production.
Right.
So by intervening at that level, they do effectively lower cholesterol. But there's other things downstream as well. Coenzyme Q10. So CoQ10, which is manufactured by all mitochondria in the body. So all cells in the body manufacture CoQ10. It's very important for maintaining energy levels in the body, muscle health. One of the patients that I had was recently diagnosed with fibromyalgia.
Right.
She came to me as part of trying to understand the underlying basis for that diagnosis, which is a diagnosis of exclusion.
Yes.
Doctor gives that term once they don't know what else to attribute it to. So after doing an organic acids test, which was a urinary collection, we found that her CoQ10 levels were depleted. And she had actually been supplementing with CoQ10. So now the next step of my detective work is to see what caused a depletion in CoQ10 when she's supplementing. And her medications. Statins are very well known to
drawing it right out of the system.
Right. Now, she wasn't on statins, but she was on antidepressants, which also had that same effect.
Okay.
Statins are probably better known for doing it, but it can certainly happen among antidepressants as well.
So I
Interesting.
think people don't realize how many side effects or ever investigate the side effects that the medicines that are prescribed to them by doctors. They never get enough knowledge or never get enough information, and they don't realize it. And if they do, they don't really think about, gee, could this be a reaction to the medication?
Right.
So it's important to know what you're on and how it does affect your body.
Well, there's so many new medications. I would imagine it'd be hard for doctors to keep track even of what side effects are if it's something that's new to the market. You know.
And in your practice, do you not see people come in on so many multiple medications?
Oh, very common, very common. And there's no peer-reviewed clinical trial shown for the safety of all the different medications together.
Right.
So my approach to medicine and wellness is trying to restore balance, and if we need those kind of interventions, then at least we have them as options.
Right.
But if we can restore using the constituents of the body, the vitamins, the minerals, looking at diet. So looking at diet is probably one of the first things I do with a patient.
So you would recommend a diet recommend certain things that they eat depending on what their issue is?
Sure.
You
And,
build them an outline. And what's nice is that you are basically in the tri-state area here of New York and Connecticut, located in Newtown, so you're accessible from, and I know when people are run out of options, you have said you had people as far as, right, from New York State come over to visit you, and things like that?
Oh
right?
yeah, I had one gentleman from Beacon.
Right, right.
And-
So, right.
Yeah.
People will make the trip when they're out of options or they're
Right.
that desperate.
Certainly, certainly. I do a lot with Lyme disease also, and so there's a few patients I have over telephone consultations, one
Right.
located in Colorado.
Wow.
But I think it's because, although the health insurance companies have kind of caught on that physicians like myself will cost them less, so they're happy in general to credential naturopathic physicians.
Right.
It's still not a profession that's regulated in all states. It is in Connecticut since like 1913.
Right.
It's,
But
Oh,
it's,
wow.
but it's getting there. I know more medical facilities, hospitals are starting to bring in different types of therapies finally. They're breaking down the wall and allowing people like yourself to come in and look at it from, you need to work together.
Yes.
There's no simple solution to any one problem. And so I think that's great. I think if I have some issues, I'm going to look you up and come see you. Which, if you speak to my wife, you'll know that I have several issues.
we do some counseling.
It's the crime scene right here.
So that'd be great. Well, good.
So
Good.
just so I understand, so you're saying that you go through, you might look at something, if someone has an issue, you might look at their diet and talk to them about nutrition and things like that. What's the next step? Is there something else that if you didn't feel like that was really handling the problem entirely?
Right, and with cholesterol, and because cardiovascular disease, the #1 killer in America, statins, the #1 prescribed medication in America.
Wow.
It's the chronic potential for problems is clearly significant. I'm usually doing more than just dietary recommendations.
Right.
I should say, as part of the dietary approach, saturated fats are, many people have become aware of. The American Heart Association has done a great job raising people's awareness levels
right.
and,
Yes.
and educating people
Absolutely.
about their role in minimizing those. But high glycemic foods are another factor. So that's high sugar foods that have a quick response to blood sugar within the body.
Right.
Those also contribute to elevated cholesterol levels. They're not discussed nearly as much, but they very clearly become influencing factors.
Now, excuse me for one second, do they clearly tell you how much sugar or the different types of things that might be disguised as sugar, like in drinks and juices and stuff like that, that they would add extra sugar to it? But it wouldn't say sugar, it would be like fructose
Sometimes
or
they have other
something like that.
names, right.
Exactly,
yeah.
exactly. The high fructose corn syrup is,
Yeah,
is
the
a
corn
classic
syrup.
example.
Right.
That's a kind of
Right.
a misleading term. No one thinks that's sugar. It's corn syrup. Well, what could that be?
Right.
Right, and unfortunately, it can have very damaging effects in the body with elevated sugar levels, the blood glucose levels, as well as the insulin, which is the hormone that's secreted by the pancreas to sequester those and try to control those levels. Even
Right.
sustained insulin levels over time can be very destructive in the body.
I mean, I've seen people drink Coca-Cola at 8:30 in the morning. So, but over years and abuse, it all catches up to you.
Sure.
So, did you
Sure,
find
and-
in your practice any specific age group now coming to you, or do you treat from maybe a 3-year-old to a 90-year-old, or?
Oh, I do a lot of pediatrics, so topics like ADHD is something I routinely lecture on. And,
Right.
That'd
That'd be a
Right.
great segment for
yeah,
a show, because
yeah.
that is really,
So you have other ways to treat that other than medication.
Oh, certainly.
Yeah.
And that gets more probably into the amino acids, neurotransmitters.
Right.
Uh,
Okay.
yeah, because I noticed there's like trends. I see a lot more children with asthma. I see a lot more children on psychiatric medicine, just from training the different locations and facilities. This is what I'm starting to see. Another interesting thing I think is going to be great for your career and your position is that we are definitely, as from the American Heart Association, we're saving more lives. So we are keeping people alive longer. Now, the key is that if we're keeping them alive longer, what's the quality of life going to be? Nobody's studying that. Nobody's figuring that out yet. So they have a cardiac episode, we shock them, we bring them back, they do a procedure. Now, where do they stand? They're going to live another 5 to 10 years, but what's the quality of life? So they really need to figure that part of it out as well. I think
yeah.
that's ground that hasn't been covered
Right.
yet.
Absolutely. Do you work with a lot of older patients as well?
I do.
Yeah.
I do. And